I may sit on my foot.
Good morning.
It's okay.
Good morning, everyone.
Good morning.
How's everybody doing? How's everybody doing for a Friday? Week 7? Pretty good. We're over halfway done. If everybody could put their name and their campus in the chat, I would appreciate it. And if everybody could turn their cameras on, I would also appreciate that. That'd be great. Yeah, I think we'll get started. We're going to cover the 2 chapters from last week, 13 and 14, and then cover the chapters from this week. Has anybody had a chance? Has anybody had a chance to review that information in the last couple of weeks? I know last week was a exam week, but has anybody had a chance to review anything over the last couple of weeks? Do we know what we're covering today?
Oh, we don't have nothing to eat. I'm hungry.
Yeah, be quiet.
Okay. Anybody know what we're covering today? Everybody's quiet. So nobody knows what we're covering today, huh? Okay, we're going to cover community assessment and evaluation. We're going to cover health education in the community. That's from last week. And then we're going to move into economics of healthcare, violence and human abuse, and then infectious disease. Okay? Does anybody have any questions?
No, ma'am.
Okay. Thanks to all of you for turning in your group projects. I'm looking forward to reading those in the next couple of days. Don't forget you have to do 2 peer responses. Again, I don't want to keep saying this, but whoever doesn't have their camera on, if you could turn that on, I would turn them on, I would appreciate it. Congratulations to the scores from exam 2. They were actually quite good. Lots of improvement. For anybody who wants to review the exam, I'm more than happy to go over the exam with you. Okay, whether you got above a 78 or below a 78, I would highly encourage the students that got below a 78 to set up a time to meet with me. I would appreciate that. I think it would be really, really helpful. I've already met with several students, but I'm open to reviewing the exam with anybody. Okay, so keep that in mind. So just a time frame going forward. This is week 7. Next week so week 7 will cover 6 and 7 material. Next week there's no class, right? Everybody knows that Friday after next week's Thanksgiving, right? Yeah. Friday there's no class. Okay, so I do, and I'll send this out in an announcement, I do have a Wednesday class, RN class. I teach between the RN and PN program, but I do have a Wednesday RN class. It's from 1 to 3 next week. If you would like to attend a live lecture, there's a lot to cover next week. There's like 8 chapters, right? And then after next week, we're done with content, and I'll go through that in a second. But you will have the opportunity to go to my Wednesday class if you want, or watch the recording, either way. And I'll have to send out the recording to you guys from my Wednesday class. Okay? So if you can't go to the Wednesday class, just make sure you watch the recording at some point, because let's see, because that will be week 8, and then you'll have your exam coming up in week 9. That's your last exam. All right. So also please look at the review schedule for exam 3. I need to make sure about study guide 3. I was hoping to have that to you guys this week, so I'll double check on that with Dr. Lundy, find out when that's coming out. Okay, so there won't be any class next Friday. All righty. What else do we want to go over? Hopefully everybody's working on their vulnerable populations assignment that's due in week 9. If you haven't started working on it, I would encourage you to start working on it, because it is a research-based project. And it's going to take some time to complete it. I sent you your HESI study guide this past week, right? Did everybody get that? Okay. Don't wait till the last minute to open that. Don't be intimidated by how long it is. That's essentially a study guide from the whole term. Okay, so a lot of the things in the study guide, HESI study guide, should be familiar to you. Okay. So please have a look at that. Don't wait till week 9 or week 10 to open that. So just a timeline here. This week we'll do our content from week 6 and week 7. Next week there's no class. You'll have to watch the recording. Okay, week 9. So next week is week 8. Week 9 is an exam. And then on week 10, we do a HESI review during class. Everybody does a HESI review. All the instructors do a HESI review. Okay, so week 10. So the way we work week 10, I think there's 12 or 13 sections of community. So you need to attend this section and we'll do a HESI review, but we'll also send you out the schedule of all the other sections so that if you want to attend another HESI review from another instructor, we're all doing HESI reviews that week. Does that make sense? So you can go to this one in your regular class, you can go to another one in another class, you can go up as many as you want. Okay, so that's week 10. And then week 11 obviously is your HESI, and then the end of week 11 into week 12 is your remediation. Okay, so does everybody or anybody have any questions about that timeline? Okay. Okay, so let's go through some content here. I'm going to share my screen. Oh, the other thing too, sorry, is I'll be turning homework grades off this weekend. Okay, so right now your total grade is your has homework included in it. And for the most part, everybody in this class is doing fine with turning in their homework. And so your grade is actually increased, right? But for those of you that are not turning in homework, your grade will decrease. Okay, so we're in week 7. So anything from last week, you're able to still turn in for a 10% deduction. But anything before week 6, we can't turn in. Okay. Okay. Okay, let's I want the rest of this class going through content because I have lots of questions as we're covering content. I would really like for people to participate. I know it's early, but I would like for people to participate. So let's start with I'm going to start with chapter 14 first, and then we'll go back to 13. So my first question to you is, why is health education so important in the community? I don't like to call on people. I really don't, but I will today because there's lots of discussion I want to have with this content. So why is health education so important in the community?
It acts as like primary prevention, so it can help people avoid illness down the line.
Perfect. That's a really good answer. Yep. And as much as anybody else? What do you think are some ways that have you guys?
Kind of like also like what she said, but it'll help them change their views and attitudes toward things. Like just health in general. Like they might not have enough knowledge about vaccines or, just because they're cultural differences and stuff like that. So yeah.
Yep. Excellent. Excellent. Remember in the community, remember we're taking all of our knowledge that we've learned in nursing school, our peds, our OB, our fundamentals, our geriatrics, and now we're applying all that knowledge into the community setting. Okay, so one thing to remember with community, and we've talked about this prior, is when you're working in the community, your client can be of any age group.
Anybody.
Right? Of any age group, all the way from infants all the way up to the elderly. And also remember that your client could be an individual in the community. It could be a family in the community. It could be a specific group of people in the community, or it could be the entire community. So our clients could be a variety of individuals or groups, and also across the whole lifespan. And so health education in the community is going to vary, right? It's going to vary on your population, maybe on the gender, the ethnicity. Okay. So one of our primary responsibilities or roles as a community nurse is teaching. That's a huge responsibility of ours. Okay, so remember, I've highlighted the objectives, and everything I've highlighted in the chapter going forward is knowledge that will be able to support you to answer these objectives. That's the goal. Okay, so if you haven't done your reviews or previews of these chapters, go back and start with the objectives. Okay, and that's what we need to answer. Okay, so let's see what we need to know. Okay. Okay. So I'm just going to read this paragraph, this part here, because this kind of outlines the whole chapter. One of the best ways to manage healthcare costs is obviously for people to stay healthier, right? Nurses are in a prime position to work with clients regarding health promotion, health education. Okay, we're using our primary, secondary, and tertiary knowledge for whatever topic you're covering, and we've gone through that in each chapter, right? And as I said, we work with individuals, families, or groups, right? So obviously the goal of health education in the community is to have optimal health, like Juanita said, prevent health problems, and then try and treat health problems early, right? That's what primary and secondary is all about, right? Primary, remember, is education to prevent. And remember, secondary is screening to try and identify issues before they get to tertiary. And so right off the bat, our Healthy People 2030 goals and objectives are related to health education in this chapter, because that's what the chapter is about. Why would we want to increase the health literacy of the population? What's the difference between health literacy and health illiteracy?
Health literacy is like them knowing about their health, like they can know, okay, you have to take like acetaminophen, take it like 3 times a day. You know when, like, you understand what the doctors are telling you, what the nurses are telling you to do. If you have to take your medication, you know when to take the medication, how to take the medication, and when not to take, you know everything about it. So that is health literacy.
Yep.
But
Excellent.
illiteracy, you don't know nothing. So
Right.
you can miss your dose or miss something.
Yep. Thanks, Sabini. One of the biggest issues with health education is the literacy level. You'd be amazed at how many people are health illiterate. Doesn't mean they're illiterate in general. It means they're health illiterate. They, for whatever reason, and we'll talk about that, could be a language barrier, could be a comprehension barrier, could be many reasons, but health illiteracy is a really big challenge in the community. Actually, it's a really big challenge all around, whether you're working in a hospital, a clinic, a workplace. Increase the proportion of adults offered online access to their medical record. Why? Remember, Healthy People 2030 are national objectives. Okay, so why is it important to increase the proportion of adults to have online access to their medical record? Why is this important?
So they'll know what's going on, like with their health to kind of like stay on top of it.
Exactly. That's why all these websites like MyChart or have popped up so that we can have access to our medical record, as can multiple physicians, right? If you have one record somewhere and you're seeing several physicians, they can see what each other are doing, right? You can see what the big picture is. And that's really become popular over the last several years, online access for both the patient and the caregivers. Okay, and then the last one, increase the proportion of work sites that offer employee health promotion programs. Why is that a national objective? What's the importance of that? You guys aren't going to be able to stay quiet for long. I'm going to start calling on people. What would be the importance of having health promotion sites in your workplace? Health promotion programs in your workplace?
Because people go to work. They'll go to
very
work before they go to the doctor.
It gives like resources to people.
Mhm,
Like a lot of people just don't know where to look.
mhm.
So that's why they don't do anything. So having options,
Yep.
there's really no excuse not to look at it.
Yep. When I worked in a big school district here in Colorado, and we actually had a whole department that was health and wellness. And they offered numerous programs for whatever competitions between schools for walking, or, participating in 5K, 10K events, lots of different programs. If you can offer health promotion programs at work, maybe they're more likely to take advantage of those. Okay, and of course, health promotion is prevention, right? So anyway, 3 really important Healthy People 2030 goals. Okay, there's 3 different domains that people learn, okay? The nature of learning. Okay, we learn 3 different ways. We learn the cognitive way. Cognitive is more the thinking way. Includes memory, recognition, understanding. I'm on page 253, if anybody wants to follow along. Okay. Affective domain is kind of the feeling, right? Changing attitudes, development of values. Okay. For effective learning to take place, you need to have an understanding of how people feel, how people think, what are their values. Remember, we're covering health education. So put yourself in the position of the health educator for this chapter. Okay, you are the health educator, so you need to have an understanding of all these things in order to do effective health teaching. Okay, and then there's the psychomotor domain, which is kind of the hands-on. Okay, maybe teach back method, maybe teaching people how to use their glucometer, hands-on. I am more of a we all learn from all these 3 domains, but primarily I in particular learn from psychomotor. I like the hands-on thing. I can't have my kids telling me over the phone how to set up Netflix on my TV with a clicker. I have no clue. I can't follow their directions. But if they sit beside me and do it with me, I can do it that way. What about you guys? How do you learn? What's your primary learning for each of these 3, or for these 3?
I'm the same way. I have to see it. Like I don't do well with people just telling me. I have to be able to see it on paper or see somebody do it.
Yep. Anybody else?
Mine is hands-on.
You're what?
Hands-on, like the psychomotor domain.
Yeah.
For
But
me,
Go ahead.
for me, it's like application and recall.
Mm-hmm. Okay. But we need to remember, though, that when we're teaching, we may have a group of people that learn from each of these domains. That's their primary way of learning. So we have to be mindful of that as we're planning our teaching. Okay. Obviously, to do any kind of health program, the first step is your needs assessment. How do we know what we're going to teach if we don't know what the client needs? Right? So we have to understand what they want to know. Okay. Are they ready to learn? What are the barriers to learning? I mean, what if you have a large community group and you have all the way from kids all the way up to the elderly? What do you need to know about each of those groups? What if you have hearing impaired? What if you have visually impaired? What if you have vulnerable populations all in the same group? You have to be able to use your nursing process with your needs assessment. Okay. Motivation is another big thing, a big factor in health teaching. Is your group motivated? Are they not motivated? Okay. So here, if we look at trying to think about the nursing process in health teaching, first we identify the needs. Then we develop them right here, the goals and objectives, after we've identified the needs. And remember, there's a difference between goals and objectives. Goals are long-term. Okay, an example, each child in the 3rd grade will participate in 30 minutes of daily physical activity, 4 days per week for 2 months. That's long-term. But objectives are short-term. Okay, within 2 weeks, each child will be able to demonstrate at least 2 exercises they've learned. So remember, there's a difference. But from our learners, from assessing the needs, we develop goals and objectives. Goals long-term, objectives short-term. Then we implement our program, and then we evaluate it. Okay? Let's review the levels of prevention, okay, for this chapter, health education. So primary prevention, education at health fairs regarding immunization, older adults, people with chronic illnesses. Why is that primary?
Because it's a prevention method.
You're trying to teach them about, right, you're trying to teach them about the benefits of immunization for not only kids, but older adults and people with chronic illnesses. Secondary, health education fairs regarding early diagnosis and treatment of diabetes or high cholesterol. Health screenings with the goal of shortening disease duration and severity. With secondary, remember, you're screening for risk. You're trying to identify things early so that you can hopefully shorten the disease duration and severity. So it's early identification, early intervention. And then tertiary, education and rehab centers or adult daycare centers to help individuals who had a stroke, help them maximize their function. Why is that tertiary?
Because they've already been affected by the disease. They're just
By
trying
the
to
stroke, right?
keep it from getting worse. Or
Right. Yeah. Trying to help them manage whatever has happened to them, whatever disease, condition, event. And by this time, we have to have a really solid understanding of primary, secondary, tertiary. There's numerous questions on each of these exams when it comes to primary, secondary, and tertiary. Then I'd like for you to review this. What are the skills of an effective educator? Okay, there's 2 areas we need to explore. the educator skills and the learner skills. Okay, educators, us teaching them. Learners are the people we're teaching. So what are some good skills of an effective educator? And they're listed right here, the 7 of them. Gaining attention, being able to articulate your goals and objectives. Do they have any previous knowledge of the topic that you're teaching? Okay. We need to present them with clear, organized information in a very simple manner. Okay. How can we help them apply what they're learning to their current daily situation? And then we certainly try to encourage them to demonstrate what they've learned. And then provide feedback. Okay, so those are the skills of an effective educator. What are some educational issues and barriers to learning? Okay, well, we know that different populations, different individuals require different learning strategies, different teaching strategies. We also have to be sure that they are prepared to overcome the barriers to learning. Really important, they have to be motivated. I guess that's motivation. They have to be motivated to overcome their barriers to learning. And then we need to also consider the appropriateness of technology. Okay, will technology work for the Gen X group? Probably. Will technology work for the elderly group? Not so sure. Okay, so we need to be mindful of who our group is. And so here's some educator-related barriers that we might have with regards to if we're teaching. And I want you to go through this. It's on page 259. We'll go through a few of them. Fear of public speaking. This is from our perspective. If you have a fear of public speaking, you're going to have to work on that. Because if you're out there in front of people teaching and talking, you need to be comfortable public speaking. Public speaking, right. Lack of credibility. Okay, we have to be knowledgeable about what we're teaching. We don't want to give off the impression that we're not credible in the topic we're teaching. Okay, do you have an inability to deal with difficult learners? What are difficult learners? Okay, there's a lot of several things you could identify with difficult learners. Okay, are you comfortable knowing how to gain participation? Okay. Okay, so now learner-related barriers. So this is your audience, and we talked about this. 2 of the most important learner-related barriers are low literacy and motivation. So how are you going to deal with that? How are you going to plan your teaching programs around that? Has anybody ever taught a class or a program? Has anybody ever taught?
No, ma'am.
Nobody. Okay.
Well, I haven't.
Has anybody ever worked with a small group of peers and taught about something that you've recently learned?
Yeah, in my workplace, then I was the labor coordinator, like the workforce coordinator. So like a workforce coordinator, you talk to people that comes into the because it was it's a warehouse. So people that comes into the warehouse, so you talk to them like what they need to know, what they do in the company, what they don't need to do in the company. Like you just teach them generally, like in the company, like you don't need to have nails, don't need to have eyelashes. You need to dress professional. You need to put on your shorts. right? Like you tell them what to do. Like, but you will know, like some people are really getting what you're saying. When at the end we do like a quiz, a little quiz, a little quiz to know how effectively they really learned. So because I do it then, so I will tell them like, okay, what is this? What is this? Like a feedback to really know if they really understood what I said. So
Okay.
like most of them they do.
Okay. So I have a question. So I have a question for all of you. So one of the challenges I have right now in this class is getting people to participate. What should I do? I'm asking you guys, what should I do? That's a barrier for me right now. Well, how can I get you guys to participate? If you were the teacher, what would
I mean,
you?
I think you're doing a good job getting us to participate. We're talking more today than usually.
Yeah, I agree, Alicia. A little bit more.
And also we have had like study Zooms. So I mean that's a form of like we all take turns like breaking things down when we study. So I mean that's teaching.
Yep. Yep. All right.
People can communicate when you call their names because some people don't want to talk.
I don't like to call names. I don't like to put people in that situation. I don't. But I like for people to participate. I really do. I don't like to hear myself talk the whole time. So
Yeah, I
anyway,
think some people are still shy. Like,
I
you
know.
personality. I mean, I'm not shy, but
yeah. Yeah. So here's my next question to you guys. So since we're all supposed to have cameras on, what do I do with the students who don't turn their cameras on? I'm asking. I'm the teacher and I'm doing a program. What do I do? Just keep stopping and asking people to turn on their cameras or just let it go? I don't know if people that don't have their cameras on are present. I don't know if they're listening. So what do you guys suggest? This is real life.
I think everybody's responsible for themselves and their grades. And if they choose that they don't want to participate and they don't want to turn the cameras on, I think it's a personal choice. And if they don't do well in the class, it's their own fault. I mean, there's really nothing you can do to make that happen.
Hillary's taking the hard line. Okay.
I mean, it is what it is.
Yeah. Okay.
I agree because I mean, you can also, I mean, it's recorded. So if those people who don't have on their cameras and stuff, you can go back, look at the recordings and boom, here you go.
And if you don't, like for next week, when you get the recording, I hope you watch the recording, but there's only so much I can do, right? And so I understand what you're saying, but this is real life teaching now and some of my barriers that I'm facing. So I just thought I'd throw it out there since we're in real life here now. So I'm gonna take Haley's advice and I'm gonna go back and share again and we're just gonna keep moving along. How's that? But thanks for your feedback. Because there may be times when you're doing health education that you'll be in the same situation. How do I get people to participate? How do I know they're learning? How do I know they're following along? Okay, just a couple more things in this chapter. There's a couple of health promotion models, okay? We know that literacy and motivation are the biggest challenges when we're teaching. So one of the models, it's called the health belief model. The only thing I need you to know about the health belief model is that it's used when we think motivation is going to be the issue. Okay? That's the health belief model. And then this TTM or PAPM, it's called the theoretical model, TTM, and then the precaution adoption process model, the PAPM. These are discussed, these are used to go through stages. So to go through pre-contemplation is the stage where you think, am I going to change my behavior? Or they don't even acknowledge there's a problem and we're not going to do anything about it. Once they move into the contemplation model, they start thinking about maybe I need to change. And then preparation, they start the preparation for change. Action, they have a plan. So that's the difference between the two models. I just need you to know that the HBM is about motivation, and these other two, which are usually used synonymously, okay, they're models of progression. Okay, makes sense? So you need to know about those two for the next exam. Okay. Is that it for this chapter? Yeah, that's it for this chapter. I always suggest you go through the remember this. A lot of information in this remember this section will help you to answer the objectives. It's a summary of the chapter. Okay. Okay, let's take a step back and go to 13, because now that we've talked about health promotion, how do we do a community assessment, and why is a community assessment important? Let's say you're the public health nurse, that community health nurse has just been hired on in this community, and the first thing you're asked to do is, we haven't had a community health nurse in 5 years. So you're new, we need you to tell us what's going on in our community. How do you think you do a community assessment? Think nursing process. Okay, a community assessment is different than assessing a patient in the hospital. So take off your hospital hat and let's go into the community. You're walking into this new job. How do you do an assessment for the community? What kinds of things do you want to know?
Probably like lots of research and maybe like previous reasons for hospitalizations or something that's like high within the community that's been going on, maybe.
So maybe what are you saying? Maybe what health issues are going on?
Right. So like different diseases that may be common among the community that people have required hospitalizations for or something like that, or been seen at clinics.
Yeah. Is it an elderly population in the community that may have lots of chronic diseases? Yeah. We probably want to know about what are the boundaries of the community? What's the population breakdown of the community? What does the transportation system look like in the community? Is it a densely populated where people live close to each other? Or is it a spread out community? What kind of stores do they have? Are people out walking the streets freely with their dogs? Is it a community that has a high crime rate? Is it a community that has environmental risks? Like, is it near a highway? Is it near an airport? Is it industrial? Is it agricultural? Right? Those are all factors that when you're doing a community assessment, you got to take into consideration. Okay. So first, so when we talk about all the different populations, a community nurse, individuals, families, groups in a population, here's where we talk about the whole community as our client. Okay. So remember back when we talked about community-oriented nursing and community-based nursing. Anybody remember the difference between the two of them? Remember, community-oriented, you're trying to get yourself oriented to the community. It's a big picture, right? You're looking at what the needs of the community are. Where if you're working in a community-based model, what's the difference? What's community-based? You got to know this. This is on your HESI. Community-based means you're already working in the community with ill clients. Do you remember that? You're based in the community. All right. Another word I want to throw in here is population-focused health. That's essentially community-oriented nursing. Okay, so you're looking at the whole population. Okay? So you're looking at population-focused healthcare. The community as a client, so think of the community as your patient. Okay, you're looking at what's the best for the community as a whole versus individual health, which is your community-based nursing. All right. So when we're focused on community, that's our patient, that's our client. We are doing primary, secondary, or tertiary, right? Depending on what we find in our assessment. Okay. So population-centered practice seeks healthful change for the whole community. So again, you think of population-centered as community-oriented. Okay, a couple of ethical concepts. We've already had the chapter on ethics. So let's go back and take our 3 ethical concepts that are applied to community nursing. Okay, utilitarianism. Do you remember that? Doing the greatest good for the greatest number of people. And then distributive justice. What is that? Do you remember that from your exam too? Meaning treating people fairly and distributing resources and burdens of the community among all members. Okay. And then social justice concept means ensuring that vulnerable populations are included in the equitable distribution of resources. So those are the 3 primary ethical concepts we take into account when we're looking at our community assessment. We do need to know this, guys, the WHO. Okay, they have 4 strategies for healthy communities. They're right here on page 745. Oh, excuse me, that's the time. 239. Supporting individual health, promoting quality of life, distributing the resources needed for basic sanitation and hygiene, and creating accessible healthcare services. What is the WHO? What does WHO stand for?
World Health Organization.
Mm-hmm. So are these goals for the United States, these 4 goals? Or are they for South America, North America? Who are they for?
Like for the entire world.
It's
The whole world. These are they're international. Okay. And remember the only international organization that we cover in this class is the WHO. Okay, World Health Organization. These are their aims for worldwide communities. Okay. And then Healthy People 20. Oh, somebody needs to mute. And then remember Healthy People 2020, or excuse me, 2030. That's the national objectives for our country. Okay, and here's their 5 goals. So have a look at that. Okay. Community partnerships. Why are community partnerships important when doing a community assessment? What is a community partnership?
When you join in with different like people within the organizations or groups within the community.
So give me an example.
Like
how about food banks?
Definitely, yeah.
What?
No, I said definitely,
Yeah,
yeah.
food banks,
Um,
right?
yes,
What
ma'am.
what other partnerships are important? Let's say you live in a community that is full of crime and you're trying to solve that problem. Who might you partner with?
The police department,
Exactly.
sheriff's department.
Yep. Let's say you live in a community that has a high risk of suicide and you need to tackle that. Who might you partner with?
Maybe
local
the-
mental health department.
Yeah. So think of all these different issues that can come up when you do your community assessment, and then you think of who you would partner with to help you with this. Right? Let's say the graduation rates for high school are way down. So you want to solve this problem. So who do you bring together? You know, your educational experts, parents, right? So community partnerships, the point of this conversation of community partnerships are critical in helping to solve issues that you've identified through your community assessment. Okay. What's the role of us? What is our role in the community? Okay, let's look around, ask all these questions. What is the most important thing? Ooh, did my Zoom go out? Sorry. What's the most important thing we have to develop? We've talked about this in previous classes. Anyone?
Yeah.
Well, trust. We have to gain the trust of the community, right? Credibility and trust, right? Because once we go in there, we're going to be starting to ask questions, interview people, partner with different agencies. We have to be able to be trusted, and we have to be able to be seen as credible. So those are the two most important things. So if you're asked on the exam, what's the most important thing? What are the most important things that, as we begin our community assessment, that has to be established right off the bat? Trust and credibility. Make sense? And then I'm going to ask you to read this next part on your own. This is community assessment through the lens of the nursing process, through ADPI. Okay? I'm going to ask you to read this section. It goes through all the way from assessment to evaluation. We already know what assessment is, trying to figure out what's going on. Okay? This is still all assessment. How to conduct your community assessment. And it goes through each section. Okay? Windshield survey. Do you guys remember what a windshield survey is? What's a windshield survey?
It's just an overview of all of it. It's like with the I'm trying to explain it.
That's okay. Think of what it is. Windshield. You're driving around looking out your windshield. Right?
Right.
You're driving around, whether it be on a bus, your car, a bike, a walk. You're just going around doing your observations, right?
Right.
And then here's your diagnosis after you've done your assessment, planning, implementation, and evaluation. So have a read at that section, because it transitions your thinking of the nursing process into the community. Okay, and you have to be able to do that. And then again, have a look at your remember this. Nice summary of the chapter. Okay, and pick out the important bullets that support answering the objectives. So do you guys have a pretty good understanding of why education is important in the community, how to do a community assessment, I mean, that's a big part of our role in the community, is education, assessment and education. Anybody have any questions? Let's jump into economics. Boy, is healthcare expensive, is it not? We had a really good discussion on Wednesday with my Wednesday class about insurance. You know, and how many people are not insured and the expenses of it. Had a really good discussion. So here's your objectives. Okay. So what are the issues? What are our issues in healthcare? This with regards to cost. Where's all these costs coming from? Why is the United States spend the most dollars in healthcare of any other country in the world? What drives our our healthcare costs up?
Is it reimbursements?
Part of it, yep. Yep. Think of our clients. What did
I
we
think
say?
that
Go
I
ahead.
think that it may be just like the overall health of Americans. Like Americans don't have like the best diets or the best habits.
Yeah. Excellent point. And what is our this is from past weeks, so I'm tapping into your memory. What is the population that is the biggest challenge to healthcare? That was an exam question. I think on exam 1. What's our population that is so prevalent that it's eating up all of our healthcare costs? Well, think about it. Are people living longer?
You mean our
Yeah.
elderly?
Yeah. So when people are living longer, what does that go along with? Chronic diseases. Remember? Chronic diseases are our number one spending in healthcare. Okay. And chronic diseases are so prevalent because our population is living longer. But chronic diseases is the number one health expenditure. Okay. Then, of course, with the economics of healthcare comes healthcare disparities. Do you remember that? Disparities among different population groups with regards to availability of healthcare, access of healthcare, quality of healthcare. Right? In our country, health and healthcare disparities, we see it routinely from our marginalized populations, whether it's because of socioeconomic status, race, culture, ethnicity, language, sexual identity. Okay. Obviously, this strong evidence suggests that poverty can be directly related to poorer outcomes. We've been saying this for 7 weeks. Right? Poverty, the financial stability of the family affects everything, including poor health outcomes. Okay. And when you have poor health outcomes, it translates into things like reduced educational success for kids, poor nutrition, maybe low productivity in the adult workplace, and certainly unstable economic growth in the population, community, or nation. I mean, look at all the costs, the increased costs we have now. Gas, food, putting a real big strain on a lot of people. So, what are some factors that affect the resource allocation of healthcare? Okay, so this is what I guess we could say barriers affecting resource allocation. Well, we know the uninsured or the underinsured are a huge group, right? Yes, the ACA, the Affordable Care Act, and 214 definitely increased the participation, but there's still millions of people that are underinsured or uninsured. And what happens? What happens to that? Access, quality care, long wait lines, or not seeking health care, right? So we talked about access, rationing of health care. What does that mean? Implies reduced access or potential decreases in the quality of care that or acceptable services that you're given. Okay, Medicaid, Medicare have certainly helped with access and affordability, but that's only part of the solution. There's many people. That's a discussion we had with students on Wednesday. Many students who are not insured. Not they can't afford it. They don't have a spouse that they can go on their plan, the expenses of premiums and deductibles. What are some levels of prevention? What are the levels of prevention for economic strategies? Primary, maybe work with legislators and insurance companies to support the Affordable Care Act, right? For health promotion services, reduce the risk of diseases. That's an excellent primary prevention strategy. Secondary, encourage clients who are pregnant to participate in prenatal care. Okay, to reduce maybe the costs related to a preterm baby or pregnancy complications. So you first have, in secondary, you have to identify the at-risk population, right? Why would encouraging them to participate in WIC be a positive step? Because we're identifying them at risk, to be at risk. If we can get them set up in a program like that, it may decrease the number of preterm babies. It may decrease the number of pregnancy complications. And then with tertiary, participate in home visits to mothers who are at risk of neglecting or abusing their babies. Okay. So if we already have identified them as at risk, we work with them to try and provide them education and guidance on newborn and postpartum care. So they've already had the baby. The event's already happened. Maybe they're at risk for abusing and neglecting their babies. So we work with them to try and not let that happen. Does that make sense? Do you understand why those are all primary, secondary, and tertiary? And then this next section, I would like for you to have a look at. It's primary, secondary, and tertiary. It's a really nice, more detailed section on these primary, secondary, and tertiary interventions if you're still having trouble articulating them. Okay. Here's our Healthy People 2030 objectives related to access to health services. Okay, increase the proportion of adults who get recommended evidence-based preventative health care. What's evidence-based healthcare? We already covered this chapter. What's evidence-based healthcare? This is on your HESI as well.
Based on evidence, things that has been done and proven before to work or not work.
Yep. And a lot of people are not privy to evidence-based preventative care, right? So we want to increase the proportion of people who are recommended. I mean, think about people in the rural areas. You know, they may not have all the updated evidence-based care for their practice. Increase the number of community organizations that provide prevention services. Why is this important? With regards to health economics? Well, if you can increase the number of prevention services, you're going to hopefully increase the or decrease the number of diseases that are developed, right?
Right.
More prevention services, less actual health issues. You're trying to prevent things from before they even happening. Increase the use of telehealth to improve access to healthcare. Why is that important?
Because not everybody can make it to the actual office.
Exactly. Think about our rural populations, right? That have issues with transportation and taking time off work to drive to cities to get care, right?
Right.
And then reduce the proportion of people younger than 65 who are underinsured. I mean, that goes without saying. You know, if you're underinsured or not insured, there's a whole set of challenges that go with that. Okay. A couple of factors that influence healthcare costs. Demographics. Okay, and here's where I talked about at the beginning of the chapter. Major demographic shift is the aging population. All right, the aging population is expected to affect health services more than any demographic factor. We already said that. And look at this, 1950, more than 50% of the population was younger than 30. Jump to the bottom. By 2020, 17% under 30. What does that tell you? And who is going to be our populations we care for going forward in nursing? Our older people, our older populations, right? So a couple of other things in this chapter is how do we finance healthcare? It's either private or public. Okay, public is your Medicaid, Medicare. Okay. Medicaid, Medicare account for the majority of the public healthcare spending. Do you remember the differences? Okay, the few things that, go ahead.
You were saying the difference between the well, with Medicare, it's for your 65 and older, and Medicaid is aid. So it's like people like they can't afford, so it's like a government funded type.
Finance need-based.
Right.
Yep. Good. Couple of things I'm highlighting here, what you need to know. The difference is you need to know exactly who just gave me that assessment. Is that Hillary?
Yes, ma'am.
Good job. About who's eligible for Medicaid and Medicare. Okay, Medicaid is needs-based. Medicare is 65 old. Remember two things: 65 or older, or disabled at any age. Right? One is a federal program. One is a joint federal state program. What kinds of coverage? Okay, this is important. Medicare has to be skills-based, nurse or inpatient, skilled nursing facilities, home health services, and hospice care. Okay. Here's what they cover. Medicaid, inpatient and outpatient hospital services. Okay. All we need to know. But you're going to get asked about the difference between the two of them. Okay, and remember that skilled nursing services is important. What's the difference between skilled nursing care and unskilled nursing care? I can tell you that unskilled nursing care is like your ADLs, right? Those are not covered. It has to be skilled. Go ahead.
the skilled is I remember an example from one of the questions where like if you have to have a healthcare aide to come out to help with like maybe a dressing change or showing how to do something that is not ADL.
Exactly. That's the difference. Skilled nursing care. You're either going out to teach the family how to do dressing changes or you're going out to do them. That's skilled nursing care. Okay? You don't need to go through, you just need to have an understanding of what I've highlighted here. Those are the most important parts of the differences. You don't need to go through and read all of these sections on Medicare and Medicaid. Okay, and then the other is private health insurance. Okay, so that's your employer's insurance. That's being able to go out into the market and buy health insurance. Okay? That's the difference. Okay, and then remember this. Have a look at that. So health economics of healthcare currently are really, really very challenging. Very challenging. Let's talk about violence and human abuse. That comes up in, let's see, chapter 27. This isn't the most, this is kind of a hard chapter, right? But we need to remember that as nurses, we're going to be caring for perpetrators of abuse, victims of abuse, and there's so many different kinds. Okay? So have a look at your objectives and let's see what we need to know from this chapter to support the objectives. We know that violence is a public health, social, and developmental threat. We know over the last couple of years that violence has dramatically increased in this country. Do we not? Here's your Healthy People 2030 goals with regards to reducing violence. Okay? The ultimate goal of violence is to try and stop it before it begins. Okay? CDC has an excellent model in their approach to violence prevention. Right? They're trying to identify early who's at risk for violence, who's at risk for being a victim, who's at risk for perpetrating violence. Right? Many, many communities are working very, very hard to curb the violence. Right? Things that affect that are the changing social conditions of the community. You know, the multiple demands on people, economic conditions. Well, we just went through a pandemic. That had a big effect on it. Social isolation, job losses. I mean, think about it. There's many, many, many reasons for violence or for the increasing of violence. People working at home, people isolated, remote school for kids. Okay. Obviously, the rate of violence varies by geographic location, density, age, group, sex, race, ethnicity. There's certain kinds of violence. You guys all know this. There's homicide. We all know what homicide is. We all know what assault is. Okay, sexual violence or rape. These are the different kinds of the big topics of violence. Sexual violence and rape. Human trafficking. Human trafficking is huge, right? We know that human trafficking is a public health issue worldwide. Okay? We know what human trafficking is. And then suicide, violence against self. Okay, suicide is actually labeled a type of violence. It's violence against yourself. Okay? We know it's a large issue. We know it's growing. Okay? especially during the pandemic. And I spent my last 2 years as a school nurse in the district during the pandemic. And towards the end, the prevalence of suicide was going up and up and up. What's family violence? What might we see in family violence and abuse? Well, we need to understand as nurses, is we're gonna be caring for these people, right? We're gonna be caring for these kids, these adults who are victims of abuse. It's not just in the community. We're gonna see them in rural settings. We're gonna see them in ERs. We're gonna see them on the floors. We're gonna see them in urgent cares, clinics. Okay. So we need to be well educated on how to recognize abuse, how to understand what characterizes abuse in families. You know, whether it's later on this chapter, but is it child abuse? Is it child neglect? Is it intimate partner abuse? Is it elder abuse? Okay. And then here's some types of family violence, right? It may not be limited to one family member, it may be the whole family, right? So if you're suspecting child abuse, is there also other kinds of abuse going on in the family? I dealt with this day in and day out in the schools, right? Really tough. Obviously, if there's family violence going on, that obviously is affecting the positive family functioning. There are issues, right? Maybe parents have low social support, no family. They have mental health diagnosis, depression, anxiety. Maybe they don't have a job. You know, the more factors, the more pressures, the more challenges you're putting on people, the higher the risk there is for abusing their spouse, abusing their kids. And we don't have to go through all these boxes, but there is some very good resources in here. This one is how to identify potentially abusive parents. That was one of my main goals when we suspected child abuse. Need to know how to potentially identify abusive parents. Child neglect, sexual abuse, intimate partner abuse, signs of abuse. And then we have elder abuse. Elder abuse is growing in frequency and significance. Okay, intentional act or omission of an act that causes harm to the adult, the older adult.
You see a lot of that, like in the like when a elderly person is like coming to the ER or newly admitted with these pressure ulcers and like not being changed and turned properly.
Yeah, absolutely. Elder abuse is growing and growing and growing, and it's considered a form of family violence. However, elder abuse in its own is a huge health issue in this country and probably worldwide. And it's like I said, it's growing in frequency and significance. Okay. What are some nursing interventions? Important nursing interventions for violence and abuse. All right. So we start with the primary, right? Primary prevention begins with a community approach, partnerships. Maybe we're working with law enforcement, criminal justice, education, social services, advocacy in the community to prevent violence. Okay. Maybe school-based. We need to know this. Okay. I need you to have a look at this. Okay. School-based curriculum that teaches kids how to cope with anger, stress, frustration, teach communication and mediation skills. This is on page 498. Please know this. Family programs that teach parents how to be better parents, how to be more effectively respond to their kids. Maybe preschool programs that help children develop intellectual and social skills.
The one that you just said where you teach the parents how to be better parents, would that be secondary since, I mean, they're.
Well, not necessarily. If you're trying to teach them how to more effectively respond to their children, if they haven't been identified as at risk yet, then it's a prevention strategy.
Okay.
Let's say the middle school offers a parent education night, and so anybody can come. That's a primary. But if we have already identified kids that are at risk for abuse because of whatever's going on in their family, then that would be secondary. Right? And these are the CDC recommendations. This is the CDC giving kind of a resource package to health providers. Okay? And here are their suggestions. Public education programs, preschool programs that help these little kids develop intellectual and social skills. Great idea. Public education programs to educate communities about different types of violence, ways to help, ways to intervene. Home visiting programs to prevent child abuse and neglect for at-risk families. So that would be a secondary, Hillary, because we've already identified them as at-risk families, right? So if we can do a home visit program and we've identified them at risk, hopefully we can stop any pattern before it starts, right?
Gotcha.
Do you understand that why that's secondary?
Yes, ma'am.
Okay. Lobbying for passage of legislation to outlaw physical punishment in schools and marital rape. So there are some nursing interventions that we could be part of. And again, don't feel like you need to read the whole chapter, okay? I'm outlining what we need to know to support our understanding of the objectives. What's our levels of prevention related to violence? Primary. Trying to prevent things before it happens. Strengthen the individual and family by teaching parenting skills. Right? That's a good one. Secondary, reduce or end abuse by early screening. Teach families how to deal with stress and how to have fun and enjoy recreation. So we are screening families that may be at risk. And once we have identified them at risk, we can work with some teaching strategies and how to help them deal with stress. And then tertiary, the abuse has already happened or is happening. So when your signs of abuse are evident, right, what do you need to do? We're all mandatory reporters. What do we need to do if we suspect abuse? Anybody?
You have to report.
Have to report it. Right? Okay. And then have a look at your remember this. So, that's a tough one. Violence and human abuse. It's prevalent, it's there, and you're going to be working with it. Whether it's kids, adults, elderly, you will be working with victims and or perpetrators. Okay? And then let's take a look at infectious disease. Let's see, we have 11 and 12. Infectious disease and prevention, communicable infectious disease risks. Let's go to communicable infectious disease risks. This is one of your attestation questions. What do we think the most prevalent Well, let's wait till we get to it. Okay, so this is our communicable infectious disease risks. Okay, so your Healthy People 2030 goals are trying to reduce infections. Okay, HPV, reduce HPV, reduce mother to child HIV, and then increase the proportion of adolescents who get recommended for the HPV vaccine. Okay, so here's what's discussed. Here are the primary infectious diseases that we discuss. HIV, and we need to know this. This is what we need to know about HIV. We want to know about modes of transmission. So please familiarize yourself with box 12.1, modes of transmission. Okay. And I'm sure you've talked about HIV in other classes as well, have you not? With your
Yeah.
infectious diseases, yes. So that's what I want you to know about HIV, is the modes of transmission. We don't need to worry about testing. We don't need to worry about epidemiology. I just want you to know about modes of transition. And then we have our STDs. Okay, big challenge in our country. Okay, and I'd like for you to have a look at the most common: chlamydia, gonorrhea, and I really just want you to know what they are. Don't worry about all this in here, just know what they are. Okay, so you have your chlamydia, your gonorrhea, syphilis, that's your bacterial. Okay, remember they're outlined in bacterial, chlamydia, gonorrhea, syphilis, and then your viral, which is HIV, HPV, and then your herpes. Okay, you with me? So what's bacterial, what's viral, and what are they? Hillary, do you have a question?
No, ma'am, my screen had froze, so I couldn't
Oh,
see it.
no
But
worries. Then it goes through each one of them. If you want more information, feel free to read. What I need you to be able to do is identify which they are. Okay, so you do not need to go through and read about each and every one of them. I just need to know what is bacterial, what is viral, the common ones. Okay, so we're going to skip through that. Okay, some of the other infectious diseases or risks are TB. Where are the most common areas that TB, you're at risk for TB?
Like prisons or jails or
Yep. Close
The homeless
quarters.
population.
Homeless population for sure. Yep. Who else?
Factory workers.
Yep. What about our migrants? Farm workers, agriculture workers, are they at risk? Sure. Living in close quarters. This is on your HESI study guide. So it goes through the steps of TB. This is right on your HESI study guide. So you are going to need to know this, right? How do you apply the test? How do you read the test? How do you interpret the test? If it's positive, what's the next step? Okay, so do have a look at this box, how to perform a TB skin test. You will see this already is on your HESI study guide. In fact, there's a pretty extensive section about this on your HESI study guide. Okay. So this is a good section as well. The nurse's role in providing preventative care of communicable diseases. Right? So nurses, or we as community nurses, from prevention to treatment, we play several roles. We may be a counselor, educator, advocate, case manager, primary care provider. Right? Appropriate interventions for primary, secondary, tertiary need to be identified. Okay, so let's look at those. This is a good one because it gives several examples. So here's several examples of primary prevention for infectious diseases or communicable diseases. Provide community education about the prevention. Right? Vaccinate for Hep A or Hep B, prevention. Provide community outreach for education and needle exchange. Those are all prevention interventions. Secondary, administer a TB test. Remember that if you're administering a TB test, you have already identified that person to be at risk. That's why that's secondary. This came up in my class the other day. Why wouldn't that be tertiary? Administering a TB test. Well, have they been diagnosed with TB yet? No, you're screening them. You're testing and counseling for HIV. Notify partners and trace contacts. What does that mean? You're identifying more potential people that might be at risk. And then tertiary, they already have something. Okay, so you have to educate the caregivers how to care for people with HIV. Okay, TB, positive TB. Follow up for that. Right? Identify community resources. They already have something, so you're trying to get them some resources for providing support and care. And then set up support groups for people that have herpes. Okay, they already have it, so you're trying to support them. Okay. So any questions? Those are the most frequent, common, communicable, and infectious diseases risks that we talk about. Okay. And let's skip to our last chapter, which is infectious disease prevention and control. We're getting close, guys. We're almost done. Have a look at your objectives. Okay, one of the biggest reasons why infectious diseases spread is migration. What do I mean by that? People are moving around. They're moving around internationally, nationally, domestically, community to community. People are traveling from one place to another all the time. All right. So this chapter covers the most common communicable diseases that we will encounter. Okay. Have a look at your Healthy People 2030 objectives related to infectious diseases. It's on page 197. Please know that. Okay, we've already talked about this in the past, but let's review it again. Communicable and infectious diseases, how are they spread? How are they transmitted? You guys remember the agent, the host, and the environment. That's our epidemiological triangle.
Oh, yeah.
Right?
It's from like the environment to the host, and then from the host to other things, whether it be like sneezing, coughing, touching, sexual intercourse, stuff like that.
Right? You have to have an agent, right, Haley?
Yep.
Yeah. You have to have an agent, and the agent has to have a host to infect.
Yeah, and then that host kind of spreads it.
And then depending upon the environment, right? Whether let's say you're in a long-term care facility and the agent is COVID, right? And the hosts are the elderly people who live in the long-term care facility. Well, that environment of the long-term care facility poses a risk, right? As we saw through the pandemic. So the environment is really going to determine how big this agent and host relationship is, right? If you're unhealthy and compromised, and let's say the flu comes along, you may get sicker from the flu. If you're healthy and not compromised, maybe, and you've had a flu vaccine, maybe the environment is such that you don't get sick. Right, Haley? Is that what you're thinking? So the agent always has to be present to infect the host. And then the environment is the wild card, depending on what's going on. Right? So that's just a review of transmission. You do need to know these 4 modes of transmission. Page 198. And I've highlighted them for you. So I need you to be able to have a short description of what each of them are: vertical, horizontal, common, and vector. You are going to get asked about that. Okay, you may be given a scenario and asked what kind of transmission, what mode of transmission is this? So know that. Okay. And then you also need to know the difference between endemic, epidemic, and pandemic. Okay, it's under disease spectrum, right? We know that endemic, it's always going to be there, the flu. It's always going to be there. When it rears its ugly head, who knows? But it's always going to be there. It's endemic. Okay, epidemic is an increase in whatever the normal expectancy is in a particular region. It's increased. So it's an epidemic. It's above normal expectancy. And then pandemic is the epidemic that now occurs worldwide. Okay? Know that there are lists of reportable diseases. That's all I need you to know is in each state, well, it's federal, but it goes down to each state. There's always a list of reportable diseases. So when I was a school nurse, I had to know what those reportable diseases were. We had an infectious disease manual that told us what diseases were reportable. Like in preschool, chickenpox was reportable to the health department. And when I say reportable, I mean like to the health department. Okay? Preschool, we had to report strep. We had to report chickenpox. For the rest of the kids, we had to report pertussis, any cases of pertussis, measles. But my point is, there are a list of reportable diseases that you need to be familiar with. You don't need to memorize it, but whether you're working in the hospital or the community, there is a list of infectious diseases that are reported to the local health department. Okay. This is one of your attestation questions. There are four emerging infectious diseases that we need to be aware of. I don't need you to know everything about the 4 of them. I just need you to know what they are. Okay, this is your second attestation question. And when we say emerging, it means over the last 10 years. Okay, so the 4 of them are Ebola, right here in this chart. Emerging, table 11.2 on page 200. And I've highlighted them for you. These are your 4 emerging infectious disease: Ebola, HIV, the flu, and West Nile. And that's what the rest of this chapter discusses, is these 4 emerging. It's kind of, when you say emerging, you just have to think over the last 10 years. Okay. And I would have a look at the rest of the information provided about each of these 4. Okay. That is a summary of the 4. Okay. So table 11.2, page 200. Those are our 4, considered our 4 emerging infectious diseases. Okay. And then have a look at your levels of prevention. Make sure you understand them related to infectious disease interventions. So here's a nice summary. Primary, the goal is to prevent the occurrences. Secondary, to prevent the spread. Tertiary, to reduce complications and disabilities through treatment. Okay. The only other thing I want to mention is vaccines. Okay, when you're educating, working with parents, working with, vaccines are for kids, adults, older adults. One of the things that we have to respect is people's wishes towards vaccines, right? There are people that choose not to get vaccinated for whatever reasons. Parents don't want to vaccinate their kids. Adults don't want to vaccinate their elderly, whatever. We have to be able to respect those decisions, okay, and not make people feel guilty or ashamed of their decisions. But what we can do in the meantime is continue to try and educate that vaccines are one of the most effective methods of preventing and controlling communicable diseases. Okay, so that's the takeaway. Okay, there are many, many vaccine preventable diseases. We can do our best at educating, but ultimately people have to make their own decision. Okay, so example, in the schools, when I would talk to parents, hey, got your vaccination card for registration. You're missing a whole bunch of vaccines. Well, yeah, I'm not going to get I don't want to get them. Okay. Then we would send them the exemption forms that they would need to complete. But there was no way I could be judgmental. All I could do is offer that you do know that, vaccines are the best at preventing and controlling diseases. Yes, we do know that, but we're still choosing not to vaccinate. Okay. Does that make sense? But it is worth educating. We have to take the step to educate, whether they choose to do it or not. And then the rest of this goes through the childhood vaccination schedules: measles, rubella, mumps, pertussis. The other thing we need to consider is, let's say there was an outbreak of pertussis in the daycare or the school. You got to contact those parents who don't have their kids vaccinated, right? You got to contact them and let them know there's been an outbreak, wherever, daycare, long-term care facility, wherever their family member's house, school, preschool. Got to be able to have a plan as a community nurse, which in my job was a school nurse. You have to have a plan for contacting parents and people that are not vaccinated and let them know what's going on, because their kids are at much higher risk of contracting the disease if they're not vaccinated. Okay. And then the rest of the chapter goes through different kinds of infectious diseases, right? You have your water, vector-borne diseases, you have your waterborne and foodborne and waterborne diseases. I just need you to know that there are these types of infectious diseases that are out there, and you guys know this. Foodborne illnesses, salmonella, E. coli, contaminated water. You have your vector-borne diseases, that's your Lyme from tick bites, mosquito bites, Rocky Mountain spotted fever, and your parasitic diseases. I just need you to know the categories. Okay. All right, so that's your overview of infectious diseases. Covered a lot today. Questions? Did you learn a lot today? Are these is a lot of
I
this
feel like I
information?
did.
Okay, good. A lot of this information may be reviews from previous classes as well.
Yeah, it's like they're kind of running
Yeah.
together.
Yeah, that's good though. And my job is to try and my role is to try and help you think about, if you're going to be working in the community, how do you take some of these concepts and topics and look at them from a community lens, not a hospital lens. Remember, community, you're dealing with a much bigger, much bigger area to try and tackle. Right? All right, let's pull up our attestation. The other thing I think I already sent you was the week 7 Kahoots. Did I send that yesterday or the day before?
Yes,
Yes.
Okay, put that in your little folder for resources for week 7. It's actually a really good Kahoots. So please try and go through that. So let's go to your attestation. What is the first question?
When discussing family violence and abuse, what are the signs of abuse?
So what could be the signs of, what are some signs of abuse?
Unexplained bruising.
Mhm.
I know there's stories that don't make sense or inconsistent stories.
Mhm.
This may
Maybe-
be far-fetched, but like how their wound may heal, like they didn't go, it's not documented, like certain.
Yeah, that's not far-fetched. That's right on target. Yeah.
Even like some body language, maybe like avoiding eye contact and kind of
Maybe
shying questions.
Yeah, maybe somebody talking for you, not letting you answer questions. Kids verbalizing things when they come to school, they go to daycare. Verbalizing abuse. Maybe the elderly. What about elder abuse? Unexplained sores. Somebody brought that up. Unexplained sores, unexplained bruising. The elderly who talks about, my son is managing all my finances and I'm capable of doing it, but he's taken that away from me. I don't know. That could be financial abuse with the elderly. But as nurses, we need to be very, very well versed and educated on recognizing abuse, family abuse, child abuse, elder abuse, and what to do about it. For me, it seemed almost wasn't daily, but at least 2 or 3 times a week dealing with child abuse, child neglect. And then your second question, I believe, is to name the 4 emerging infectious diseases, right? We just talked about those. Anybody want to?
It was Ebola,
Mhm,
HIV,
mhm.
flu, and West Nile.
Wow. Hillary. Nice job.
Did everybody get it?
I got Ebola, HIV, West Nile, and what else?
Flu.
Thank you.
You're welcome.
Don't forget to do your peer responses. Okay. Somebody said, do we have to do one for every peer? I said no. I don't know if it's in the PN or RN module. I'd have to look, but I just need one peer response and you can evaluate your whole team in that one peer response. Don't feel like you have to do one for everybody. Okay?
Oh yeah, I did one for everybody. I already submitted it, so I didn't know.
That's
'Cause
okay.
it does say on there, the instructions say for everybody, but
I know. We're gonna get that changed for next term. I really want it to be one peer response. You already have enough. And I think one peer response addressing your whole team is adequate. Okay, and then don't forget to do your 2 peer response. So wait. One is peer response. So you got to respond to 2, right? 2 of your teammates' group projects, right? And the other one is peer review. How's that? Peer review of the project. How'd your team work together? Okay. Well, I wish everybody a very happy Thanksgiving. Have a great week next week. I'll send out my Wednesday class recording to you guys. Okay. I think the official holidays for the campuses are Thursday and Friday.
So there's no class on Friday?
No class on Friday. That's a holiday.
Okay, thank you.
Yep, I'm going to send out the recording from my Wednesday class. But Abinia, as I said at the beginning, anybody from this class who wants to come to my Wednesday class, you're more than welcome to do that. And I'll send out that information if you prefer to come to a live lecture. Okay? And I'll check on the study guide. I want you to have the study guide like in the next couple of days. Okay? So you're preparing and then look at your schedule next week for when the reviews are. Okay?
Thank you.
Other than that, that's it.
Thank you.
Nice to see everybody. And like I said, have a wonderful Thanksgiving holiday. Reach out if you need anything. I mean, I'm working right up till Wednesday. I'm teaching Wednesday and probably working Thursday and Friday too. So reach out if you need anything. Okay?
Thanks.
And if you
Thank
still
you.
want to go, you're welcome. If you still want to go over your exam too, just reach out, regardless of what your score was. Okay?
Okay.
Thank you.
Bye.
Bye.
Good to see everybody.